Well, the Ministry of Health has advised wholesalers, public health institutions, and hospitals to remove all generic forms of valsartan from circulation following a second recall by drug maker Mylan Pharmaceuticals since July. Mylan Pharmaceuticals has expanded its recall of valsartan blood pressure medication to include existing lots that have not expired. Minister of Health Dr. The Honorable Dwayne Sands said the ministry will only use a brand name that has not been implicated in the recall. This comes amidst concern that it may contain trace amounts of an impurity that may cause cancer. The health minister explained how the situation is being monitored.
There is, through the Pharmacy Council, a process of directives and inspections for verification that these things are being met. Now, certainly the largest supplier of medications in the country would be the public health care system. When you get beyond that, then, there are some private pharmacies who, in the course of their inspection, we would pay attention to whether or not they're expired medications or recalled medications possibly being displayed, etc. But an educated public is very, very important.
Well, Sands says persons with valsartan containing drugs should ask their pharmacist if their medication contains a drug and ask for the brand name alternative. As to the concern over cancer, Sands says that risk should not be overstated, and while several manufacturers have found traces of two products with prolonged use may increase the risk of cancer, there's no documented evidence. The Minister of Health says this is one of the unfortunate challenges of trying to get drug safety right, particularly as some people look for an excuse not to make their prescription.
When we have a situation like this where somebody can point to, oh, I heard that this drug can cause you to get cancer, even if it's a tiny, 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 tiny risk, it interferes with compliance. So we have to look at a strategy for which medications we source in order to minimize that excuse. Because the consequences of not taking your blood pressure medicine far, far outweighs any potential risk of developing cancer